ما أريد من هذا الشعب إلا أن يزيد في الحمد والشكر إلى الله عز وجل، ويزيد من محبة الوطن، ويزيد من العمل ومضاعفة العمل لما يسعى فيه من خير له وللدولة والأهل. هذا اللي أنا أدوره من الشعب، وربنا إن شاء الله يوفقنا جميعا على ما يحب ويرضى.
Ladies and gentlemen, today we spotlight a leader shaping efficiency and trust within the evolving healthcare insurance landscape. We are pleased to welcome Mr. Mohammad Afzal Alam, the founder and the CEO of Khatt al-Haya Management of Health Insurance Claims. Under his leadership, the company has become recognized for its accuracy, compliance, and commitment to building trusted partnerships between healthcare providers and insurance entities. So stay with us, an inspiring conversation starts now.
Me, my whole company and my whole staff very much thankful to all the top leaders of UAE.
From the heart of the United Arab Emirates, where vision meets ambition and excellence becomes a way of life, welcome to Pearls of Union, a platform that highlights inspiring leaders, innovators, and success stories shaping the future of our nation. Here, we uncover journeys, ideas, and values that reflect the true spirit of the Union. In today's episode, we turn our focus to a story of dedication, growth, and excellence. In today's episode, we explore a journey shaped by vision and commitment. So please welcome Mr. Mohammad Afzal Alam, the founder and the CEO of Khatt al-Haya Management of Health Insurance Claims. Welcome, Mr., and thank you for joining us today.
Thanks a lot to you.
Well, sir, you have built a distinguished career that speaks for itself in the field of healthcare, insurance, and management claims. So, if I were to ask you to capture your story in your own words, what were the key milestones, the defining moments, and the turning points in your academic and professional background?
I, Mohammad Afzal Alam, I finished my bachelor degree in physics honors, and then I did my MBBS. After that, I came to this country long back, and I started my career joining myself into Musalla Medical Center long back in 2006. I worked there for 5 years almost. I started a company called Musalla Net TPA LLC. That was a similar kind of company, and we have worked and we have run it for almost 5 years. It was a very big company. We could achieve almost a similar kind of similar kind of success into that company also. After that, I joined Global Net TP LLC. In there also, I was a starter. I was a beginner of Global Net TP LLC. That was also third-party administration company. And after that, we started this company. Me and my partner, Mr. Farooq Ahmed. We have started this company in 2015 March. The time we started, it was almost a Corona time, but God's grace, with all kinds of support from this government and with all kinds of, first of all, we thanks to Allah subhanahu wa ta'ala, and the government, all government means right from the Health Authority Abu Dhabi, Dubai Health Authority, or Central Bank and Ministry of Health, all this government has helped us to start this company, and we have started this company in 2015 March. We started with a very small company to 5 people, and then now alhamdulillah, by the grace of God, we have got roughly 120 people in my MOL, and we have got roughly 10 to 12 local staff also working with us. So almost 120 people working with us for almost, I can say is that this company is almost 11 years old, and we have been doing a lot. We have been working with almost all the insurance companies all across the UAE, all major insurance companies, what we can say. What is that? We work closely, very closely with insurance company, with the government like Dubai Health Authority. I appreciate everyone, all the top leadership of Dubai Health Authority, on the Central Bank and Health Authority Abu Dhabi and Insurance Authority, Ministry of Health, everyone. We have been working very closely with them, and they also support us a lot because we are providing the group, we are providing the medical services to the citizens and to the expats all across UAE, we can say. So now we have been working with almost all major insurance companies in UAE, and they have been supporting us. They have been supporting us a lot, and we see that okay, fine, that patients are getting a very proper service, very satisfactory services all across UAE. What we do is that we have got lots of roughly more than, we can say, is that 2,500 clinic, pharmacy, hospital, wherein we have the contract, and we give the services to their patients. Insurance companies patient means insured patient. We give the services to them all across UAE through these networks, wherein the patient go with the cards, patient go with the Emirates ID, and they get very good services. Almost all top-notch hospitals, government hospitals, private hospitals, government clinic, all the clinics, hospital and pharmacy are there in our network. When someone goes to that particular clinic, hospital or pharmacy, they get a very proper service. This is what is our success. This is what is our, we can say, the backbone of our success, that wherever our patient go, they are well accepted, they are being very well treated, and they are being given a very great services. And what we can say is that insurance company, once they give the business to us, we never allow the clients to go in a loss, because that is what the TPA stands. We are a third-party administration company. We work under the major insurance companies, wherein we take care of their patients. We give the medical supports to the patient. We give the medical services to the patients. We make sure that okay, fine, the insurance companies are giving us the business, and we make sure that they are not going in a loss. They are going in a profit. Then only they give us the business, because this TPA model we work totally on what we can say is that TPA basis, TPA fees basis. We work on TPA fees. So we make sure that insurance company, what they give us the business, they are in profit, and we are also in profit. So almost all the insurance companies, they give us good business, and we are very much thankful to them, including the government, DHA and MOH, because they all support. Without their support, we can't do this business.
So you are building long-term relationships with your clients. Actually, you have gained exceptional experiences in the healthcare insurance industry that have shaped who you are today. You have faced many challenges, but you received support from government entities. Now, sir, let's talk about your company. How was the first step, and what was the founding vision?
By God's grace, when we started this company, we never thought that we could grow to this limit, to this small span of time. But what I say is that in UAE, whoever works hard, he fetches a lot. We have worked with full concentration since beginning. I have got, by the grace of God, we can say that I have got a very great team in my office. I have got roughly 10 to 12 managers, roughly 25 doctors I have in my office, and I told you we have got 120 staff. So luckily I can say is that we could get a very A class staff, and they have been running the whole system very properly, and they are very much skilled, we can say. They are very much professional. They've got huge knowledge and huge experience all across from A to Z. And what we can say is that when we started this company, I thought, okay, fine, we will be growing maybe in 20 years or 30 years, but God's grace, we could achieve it in 10 to 11 years. And I can say that at present we are we are handling roughly 350,000 members in my company. Means 350,000 insured members are there, which are being administered by Lifeline TPA. Okay, so we are monitoring them. We are making sure that all these 350,000 patients are being treated properly, because all these patients, they have paid the money to the insurance company, and insurance company has given us a chance, given us an opportunity to monitor them and manage the portfolio in a profitable way, so that they give us more business. So this is what we do. Sometimes it happens, okay, fine, some of the clients, they means because of some chronic patients, or because number of visits are very high to the clinic or to the pharmacies or to the hospital, wherein we see that 1, 2, 3 accounts, they go in a loss. But overall portfolio, what we see is that overall portfolio of our 350,000 lives, it is always in profit, and we give profit to the insurance companies, and we retain the business. This is what is our backbone, or our strength is. We retain the business. We don't lose the business. 98% of our business is retained. Means we don't lose the business. We renew it every year. Renew it every year. For us, there was the challenges at the time of Corona, when there were lots of patients being admitted in the hospital. So the bills were high, the inpatient, outpatient bills were high. That was only the challenges for us. But God's grace, alhamdulillah, everything, all the government has supported us, all the insurance company has supported us, and we could cross that milestone also, and we could reach to this place wherein the company is running in profit, company is healthy, and we see that all my 120 staffs are happy. We make sure that all our staff should be happy, and they are being treated properly, and they are being managed properly. Then only they treat the patient very satisfactorily.
Perfect. So as you mentioned, sir, that you have faced lots of challenges, especially in Corona period, because actually we are talking about a highly competitive field and ever evolving field. So what sets your company apart in the industry? What is your special impact?
A special impact only at the time of Corona. Slightly, we could see that, okay, fine. We could see that the bills were high, and outpatient, inpatient, hospital bills were high. But we could administer, we could make sure that, okay, fine, the patients are being treated very properly. We have not denied any patients. All those patients getting treated has to be treated properly, and we have never denied. Only that, okay, fine, there were certain kinds of burden, because the payment goes from the insurance company to the hospitals. We are just a third-party administrator. We just manage the whole portfolio, but we had managed it so well, where insurance companies also were happy, and they have never pointed out, okay, fine, the claims are not being controlled, or we are not managing the things properly. They have always given us, even in 2020, the insurance authority has given us the award. And we have seen that, okay, fine, government is supporting us so well, so we could manage the whole things very properly.
So, sir, from your perspective, what makes the UAE a supportive and an attractive environment for healthcare insurance companies like yours?
Government is there everywhere, even DHA, Ministry of Health, or we can say central bank is there everywhere, and they are monitoring the clinic. They are monitoring each and everything. All the health providers are being managed and monitored by them. We see the each clinic and pharmacy, laboratory, diagnostic, all are being managed and being monitored by we can say DHA and Ministry of Health, Dubai Health Authority and Ministry of Health. They have to provide a very good service to the patient. This is number one. And whatever we approve or we reject, it crosses their portal, and then only it goes for approval or rejections. Each and every claim, what we can say, which is being approved or rejected, they are aware. So we are doing it, very genuinely, that if the rejection is required, we do the rejection. If the approval is required, we do the approvals. So insurance, what we can say is that Dubai Health Authority and Ministry of Health, they monitor the systems very properly. They make sure the patients which requires the treatment has to be treated properly. Even in hospital, we say, okay, fine, whatever they do very genuine. What we can say is that procedures, hospitalization, admissions, they do very genuinely. Like, you know, if some surgery is required, they do the surgery. If the surgery is not required, they don't do the surgery, because everything is well monitored. The doctors are monitored, the clinics are monitored, the hospitals are monitored. The doctors can't treat of his own will or wish, because he has to treat and he has to report to the government. So everything is quite we can say is that monitored very properly.
Well, sir, you started your company in March 2015, so almost 11 years of excellence and success, and also you are operating across international markets like Oman, for example. So I'm sure that you have future plans and you are aiming to expand internationally. So what do you aspire to and what are your future goals?
Yeah, as mentioned, God's grace, I have been here for last 21 years and worked in the same industry for almost 21 years. And we have started this company in 2015 March. We got a small branch which is not very big in Oman, and we have got a similar kind of business in Turkey also. Now our expansion plan is like we want to start in Abu Dhabi. That have been we have been waiting for a long time. So in this year itself, maybe in the fourth quarter something, we have a plan to start in Abu Dhabi. This is what is our dream, because Abu Dhabi market is very well, and it is 100% insurance is compulsory. Here in Dubai and Northern Emirates also, it is 100% insurance is compulsory, but in Abu Dhabi it's compulsory for a long time, and the market is very big, market is very good, the growth is very high. So we want to start the branch in Abu Dhabi first, and later on we'll see that which country we need to get into.
So now, Mr. Mohammad, based on your experiences in this field, what words of encouragement or guidance you would like to convey through our episode to young professionals aspiring to join this field? So what skills and mindset do you believe are essential for success in this industry?
What I can say is that in this field, in medical industry, we need to give the best of services from the heart to the patient. If we give the best of services to the patient, the patients will be happy, and we will get the business automatically. Our aim since the beginning, when I have entered into this segment, I have been striving to give the best of services to the patient irrespectively. Sometimes the patient is, sometimes we'll find that, okay, fine, the limit is crossed, and sometimes we find that the patient is not covered for some treatment. Still, because I am into this business, and there is we need to be kind to the patient. We need to see that, okay, fine, patients are getting proper service. So in spite of everything, I have tried my level best. Okay, fine, even the patient has patients this table of benefit or patient's insurance is not covering some kind of disease or some kinds of ailment, but still we see that, okay, fine, the patient has to be treated and patient has to be covered. Now God's grace, it's very much mandatory. If some emergency on trauma, if the patient goes to any hospital, it is covered by the government automatically. It is covered 100%. It is covered up to the limit, whatever the insurance package they take. But from our side, what we do is that we show the sympathy to the patient, and we are kind enough to the patient, wherein even some of the disease, some of the surgery, something which is not covered, we try to see that, okay, fine, we are covering that from our end, and with the request and in coordination with the insurance company and all. So what I see is that the more we serve to the citizens and the communities, the more Allah subhanahu wa ta'ala gives us the reward. And this is what is our backbone, and we see that patient should be treated very fine. That should be our core wish and will.
Thank you so much, Mr. Mohammad, for your inspiring words. Well, as we come to the end of our episode, I would like to invite you to share a message of appreciation and gratitude to the UAE and its rulers.
Me, my whole company and my whole staff, very much thankful to all the top leaders of UAE, in particular His Highness Sheikh Mohammad bin Zayed Al Nahyan and Sheikh Mohammad bin Rashid Al Maktoum, His Highness Sheikh Hamdan bin Mohammad bin Rashid, and our Sharjah ruler, our companies. This is, I should say, Sheikh Sultan bin Mohammad Al Qasimi. I respect all of them, and all my respect, all my gratitude goes to them. Because of their support only we are surviving, and they are giving us tremendously great support, wherein we survive, we thrive, we prosper, and all my company staff are very happy, including us. Thank you very much.
Thank you so much, Mr. Mohammad Afzal Alam, for being a part of our program and for sharing your success story. It was my pleasure talking with you today. Wish you all the best.
Thanks a lot to you. Thank you. Thanks a lot for all your team members.
We would like to sincerely thank our distinguished guest for this valuable discussion. We hope this episode has provided you with new insights and inspiration. Stay tuned for upcoming episodes for more enlightening conversations, and goodbye.